Hi everyone, welcome to Ezinurse, where nursing education made easy for you. So today let's discuss regarding the model question paper of second year GNM of the subject mental health nursing. See, in the mental health nursing question paper, the duration is 3 hours. Then the maximum marks is 75. These are all the model question which is appear in the question paper. Write the meaning for the following. The first question is addiction. Second one is bulimia nervosa. Third one is insomnia. And fourth one is mania. These questions carries 1 mark. Second one is fill in the blanks. Then all the question number in series. The fifth question is fear of anxiety in closed space is dash. Here you supposed to write the proper and appropriate terminologies. The sixth one is a mild form of depression is known as dash. The next one is sleep attacks during daytime is called as what? The eighth one is imitation of words of examiner is known as what? The next questions, write short notes for any 4 of the following. See, these questions carries a 2 mark. The next question is Indian Lunatic Act. The 10th question is depression. Next one is ECT and milieu therapy. And the final question of short notes are National Mental Health Program. These are all the very important questions. Definitely they will ask for the examination. The next one is the answer the following. This will carries 5 mark. Define therapeutic nurse-patient relationship. Here you need to elaborate for at least 250 to 300 words. The next one is write the components of therapeutic nurse-patient relationship. Next question is phases of therapeutic nurse-patient relationship. The next question is define psychiatric emergencies and explain the role of nurse in the prevention of suicide. Then about true or false. The 19th question is the organizing principle of the personality is called as identity. Here you can write whether this statement is true or false. You only write true or false. You can't write the both. The next one is Asperger disorder is categorized as an autism spectrum disorder. So if this statement is true, you can write true. If this statement is false, you can write false. The next one is loss of memory is called as amnesia. If it is true, you can write true. The next one is series of words that seems totally unrelated is called as word salad. So these are all the sentences given to say whether it is true or false. The only answer should be written as true or false. The next questions, that is short notes. First one is adolescent crisis. Next one is acute psychosis. Next one is sexual disorder. Another one is mental health assessment. Next, answer the following. Define schizophrenia. Next one is write the nursing management of the patient with the paranoid schizophrenia. Next one is define psychiatric nursing. Next one is briefly explain the principles of psychiatric nursing. See, this is the model question paper. You people should highly concentrate. These are all the very important questions. Definitely they will ask for the examination. Let's study one by one. Write the meaning for the following. I have already mentioned this is carries 1 mark. This is carry 1 mark. The first question is addiction. What is meant by addiction then? What is meant by addiction? Addiction is nothing but it is a condition in which a person develops physical or psychological dependence on a substance or behavior with an inability to stop despite harmful effects. So this is collectively called as addiction. Addiction is nothing but it is a physical or emotional dependence on a particular substance or behavior is called as addiction. In the addiction also we have the varieties of classification. First one is substance addiction and behavioral addiction. For example, for the substance addiction, what are the substance addiction? It may be alcohol, it may be caffeine, it may be cigarette and all. If it is behavioral, it may be exercise addiction, it may be the gambling addiction. These are all the best example for the behavioral addiction. The next question is bulimia nervosa. Then what is meant by bulimia nervosa? Bulimia nervosa is collectively called as eating disorder. Let's study the definition. It is an eating disorder characterized by repeated episodes of binge eating followed by inappropriate compensatory behavior such as vomiting and excessive exercises or misuse of laxatives to prevent the weight gain. See, what is the meaning of the bulimia nervosa? It is the eating disorder which is followed by the binge eating. Binge eating means the person is going to eating for a long time. The person is going to having the too much episodes of food within a shorter period of time. Along with that, you have the mentality to lose the weight by inducing, by having a lots of compensatory behavior such as vomiting. So that is called as bulimia nervosa. Bulimia nervosa comes under the eating disorder. The next question is insomnia. Insomnia. What is meant by insomnia then? The word itself is saying what is the definition of insomnia? It is nothing but sleep. It is nothing but sleep. Mania means something is lacking, something is disturbing. Then what is the definition of insomnia? Insomnia is nothing but sleeplessness, or also called as sleeping disturbance. Sleep disorder which is marked by difficulty in falling asleep, staying asleep, or getting restful sleep, resulting in daytime tiredness or impaired functioning. Then what is the general meaning of the insomnia? Insomnia is a disease condition which is characterized by sleeplessness, or also called as disturbance in the sleeping. The next question is mania. What is meant by mania? Mania is nothing but it is the elevated mood. Simply we can call it as elevated mood, or also called as increased mood. Then what is the actual meaning? The mental state marked by an abnormally elevated mood. See, the word itself is saying mania is nothing but elevated mood. It nothing but increased mood. So increased energy or overactivity or rapid speech or reduced need for sleep and sometimes impulsive or risky behavior. Then what is the general meaning of mania? Mania is nothing but it is an elevated mood or increased mood or increased energy in an individual. So such condition is collectively called as mania. Then the next questions. What is the next question? It is nothing but fill in the blanks. Here you need to fill the answer which is appropriate, terminology or appropriate word should be written. What is the first question? The fear or anxiety in closed spaces. Fear or anxiety in the closed spaces. Answer is claustrophobia. See, just understand the terminology, just divide the terminology. Claustro is referred as closed spaces. Closed spaces. Phobia is nothing but it is an irrational fear. It is an irrational fear. Then what is meant by claustrophobia? It is an irrational fear or anxiety towards the closed spaces. For example, elevator, for example, tunnel. So that phobia, that fear, that irrational fear is collectively called as claustrophobia. Then appropriate answer is claustrophobia. The next question is a mild form of depression is known as. Mild form of depression is known as. Then answer is dysthymia. What is meant by dysthymia? In the depression, we have varieties of classification. We have major grade of depression. We have mild grade of depression. We have seasonal depression. We have postpartum depression. In the depression, we have mild form of depression are also called as low grade depression. That is called as dysthymia. So the appropriate answer for the fill in the blanks is dysthymia. Then the seventh question. Seventh question is sleep attacks during the daytime is called as. We have already know that what is meant by sleep. Sleep is nothing but it is a very important biological and physiological process where there is an altered state of consciousness. So that is called as sleep. If the sleep attacks means there is a inducing or unconsciously we are falling into sleep in daytime is collectively called as narcolepsy. Then answer is narcolepsy. For the sleep attacks during the daytime is called as narcolepsy. Narcolepsy is nothing but the patient is falling into the sleep during the daytime. The next question is imitation of words of examiner is known as what? The answer is echolalia. See, echo means repetition. Echo means repetition. Lalia means words. The repetition of the words is collectively called as imitation of the word or repetition of the word is collectively called as echolalia. Then appropriate answer for this fill in the blank is echolalia. Still far, I hope you can understand the filling in the blanks. You people should give a appropriate terminology for the fill in the blanks. The next question is Indian Lunatic Act. See, by seeing the word only, by seeing the lunatic only, we have to highly focus on regarding mentally ill person. Regarding mentally ill person, this act is mainly launched because to protect the rights, because to protect the right of the patient. The patient is nothing but mentally ill patient along with the society. So this is the main objective of Indian Lunatic Act. Then the Indian Lunatic Act was enacted or launched in 1912. So this is a very important year that we need to highly focus on. Next one is, it dealt mainly with the custody, care and treatment of mentally ill person. What is the main objective of the Indian Lunatic Act? This act we are highly focusing on to protect the rights of mentally ill patient, mentally ill person. The next one is, the act highly focused more on detention and protection of society rather than the treatment. Along with that, it is also protect the lots of social rights and mentally ill rights. Along with that, it is also protect lots of family rights of mentally ill patient. Next one is, admission was mainly through the magistrate order. Magistrate order is nothing but it is based on the law. It is based on the rules and regulation which is set by the government. Next one is, it was later replaced by the Mental Health Act. So previously the name of the act is Indian Lunatic Act. After some times it is renamed as Mental Health Act of 1987. Along with that, it is launched as Mental Health Care Act of 2017. So when the question is asked like Mental Health Act, same objectives can be written. So while writing all those things, you have to write the introduction for the act, along with that objectives of the act, along with that the rules and regulations in the act, along with that the nurses' responsibilities in the act. While writing all those things, you need to elaborate the answers. The next question is the depression. What is meant by depression? Here you need to write the definition of the depression and what are the signs and symptoms of the depression. What are the signs and symptoms of the depression? Then what is meant by depression? Depression is nothing but it is a mood disorder. Mood disorder. So it is characterized by, it is a persistent sadness or lowness and the loss of interest. The signs and symptoms are helplessness. The main signs and symptoms are helplessness, hopelessness. The main symptoms are helplessness and hopelessness and worthlessness. See, worthlessness. Here, depression is a very important cause for suicidal thoughts. The next point is, common symptoms includes low mood, fatigue. Fatigue means the vomiting sensation, restlessness and sleeping disturbance. Sleeping disturbance I have already discussed. Sleeping disturbance is also called as insomnia. It's also called as insomnia. Poor appetite. Poor appetite means the lack of feeling appetite and the feeling of worthlessness. It means the person is going to lose the happiness in the life and he is going to suicidal thoughts. Next one is, what are the major causes for the depression? The causes may be biological, it may be psychological, it may be social. The next, what are the management? What are the management? While writing the management, you need to elaborate the management. Management is broadly classified as medical management and surgical management. In the medical management, we have to write regarding pharmacological and non-pharmacological management. In the management includes antidepressant drugs and psychotherapy and counseling. Psychotherapy is nothing but this is a treatment we are going to giving a patient regarding the cognitive function, to alter the cognitive functions of the patient. Next one is counseling. Counseling is nothing but open face-to-face communication. Counseling is nothing. What is the definition of counseling? Counseling is nothing but it is the process of accepting and trusting and establishing the safe relationship with the client. So that is called as counseling. The next one is, what are the nurses management? As a nurses, we need to write our own responsibility. Nurses provide emotional support and monitor the suicidal risk. I have already told depression is the main cause of suicidal thoughts. So we need to highly monitor the suicidal risk, suicidal thoughts. What are the behavior which cause the patient to go for suicide? Suicide is nothing but self-harm. This is regarding depression. While writing the answer, you need to elaborate. Nearly 500 to 600 words should be used. Along with that, you need to write and organize the answer in the form of introduction, definition and types, objectives and management. Last one is nurse's responsibility. While writing the answer, you should organize the answers. Let's move on to the next question. Very important question. Definitely they will ask for the examination. That question is called as ECT. The elaboration form of ECT is nothing but electroconvulsive therapy. Generally, what is meant by ECT? ECT is nothing but it is a process of inducing the artificial grand mal seizures to the patient to reduce the signs and symptoms, of psychiatric disorder. Then let's study the points. ECT is a treatment. ECT is a treatment in which controlled electric current. See, this is very important word you need to write. Controlled electric current is induced or passed through the brain. What is the next point? It is given under general anesthesia. In the anesthesia, we have the varieties of anesthesia. We can give under general, we can give under epidural, we can give under MAC, we can give under sedation. Most commonly, we will give the ECT under the sedation. The next point is common side effects includes temporary memory loss and headache. Then the last point is nursing responsibility. Nursing care includes pre-ECT and post-ECT observation. In the ECT, we have 3 phases. First one is called as pre-ECT phase. Next one is intra-ECT phase. The last one is called as post-ECT phase. Pre-ECT is nothing but we are going to preparing a patient for getting ECT. Intra means the process of inducing the grand mal seizure under the sedation. Post is nothing but after the ECT, we have to give a comfortable position. That is nothing but left lateral position should be given in order to avoid the choking. So these are all the 3 phases which comes under the ECT. ECT is nothing but electroconvulsive therapy. It is nothing but inducing the grand mal seizures, artificial grand mal seizures to the patient. The next question, 12th question, is called as milieu therapy. What is meant by milieu therapy? So milieu therapy is also called as environmental therapy. It is also called as environmental therapy. Why it is called as environmental therapy? Because this therapy we are using environment as a treatment. We are going to using environment as a treatment. Milieu therapy is a therapeutic use of environment. It means environment is using for as a treatment for the patient. For what? For support mental health, in order to give a proper mental health to mentally ill client. The second point is it provides a structured, safe and supportive settings. See, this environmental therapy will give lots of acceptance, it gives lots of support, it gives lots of safe to the mentally ill person. The third point is it encourages social intervention, responsibility and self-esteem. Self-esteem is regarding respect. So this therapy will give a confidence, respect and responsibility to the mentally ill patient. The fourth point is it is used commonly in psychiatric ward. Yes, of course, it is agree. See, the psychiatric ward, we are commonly use this milieu therapy. In this therapy, we will gather the mentally ill patient, we will tell them to introduce themselves, we are going to help them to involve themselves in lots of social activities, cultural activity, sharing the experiences, and we are going to putting a lots of plays, games, this and all things we are organizing in the psychiatric wards. Why? What is the main objective? Because to help the patient to involve in the environment, to accept the environment, to use the environment for the treatment. The last one is what is the nurse's role? Here nurses plays a very important role in maintaining and monitoring the therapeutic environment. Therapeutic environment is nothing but the environment which is suitable for the mentally ill person for a treatment. So this is all about the milieu therapy. Milieu therapy is also called as environmental therapy. While writing the answer, you should organize the answer in the form of introduction, definition and the objectives of the milieu therapy and what is the role of nurse in the milieu therapy. The next question is National Mental Health Program. It is a very important program which is launched in India, by the central government. So it is also called as NMHP. Then what is the objectives of National Mental Health Program? Let's study the points. NMHP was launched in the year 1982 in India. The next point is aims to provide accessible mental health care. Accessible means it is available for everyone in all the group of society, irrespective of caste, irrespective of gender, irrespective of creed. We have to give care which is accessible for everyone, each and every unit of the society. The next point is focus on integration of mental health services with the primary health care. So another very important objective is nothing but we are integrating the primary health care along with that mental health services. Primary health care is nothing but it is a accessible health care. It is a accessible health care that should be merged with the mental health service. That is the main objective of National Mental Health Program. The next one is promotes prevention, early diagnosis and rehabilitation. These are all the very important objective of national mental health program. What is promote prevention of mental illness and promotion of health and early diagnosis. So we have to diagnose the case early, then only we can give proper management. Based on the diagnosis, based on the stage only, we can give the proper management. Next one is rehabilitation. Rehabilitation is nothing but it is a process of bringing their habilitation again. It is a process of giving emotional, economical, financial, cultural, educational support to the patient and the family. Then what are the steps what are the cadre in the National Mental Health Program? First one is District Mental Health Program, are also called as DMHP. Then another we have sub-districts. Last we have to go for primary healthcare services. These are all the components of National Mental Health Program. Then what are the components? First we have regional hospitals, we have district health hospital, next we have sub-district or also called as taluk hospital, last one is called as PHC. PHC is also called as primary healthcare hospitals. This is regarding National Mental Health Program. While writing, you need to start with the introduction and end with the roles and responsibilities of nurse in the given program. Then the next question, what is the next question? The next question is define therapeutic nurse and patient relationship. Here they have asked the relationship between nurse and patient. Then what is the definition of nurse and patient relationship? See, the therapeutic nurse-patient relationship is a professional. See, they have given the code word professional. It should be professional and it is a goal-oriented relationship between the nurse and patient established to promote the patient physical, emotional and mental well-being through a trust, respect, acceptance and effective communication. Then what is meant by therapeutic communication between the nurse and patient? So it is a healthy communication. It's a professional communication which is established between the nurse and patient for what? For promotion of health, for the prevention of illness and rehabilitation of the patient by using a lots of components such as trust, respect, confidentiality and effective communication should be maintained in the therapeutic nurse and patient relationship. The main objective is promotion of health, prevention of illness and rehabilitation of the patient. See, in the relationship, the code word they have given goal oriented. So this relation should be towards goal, towards objective, towards planning. So what is meant by therapeutic nurse patient relationship? It is about the effective communication for the promotion of health of the patient. The next question is components of therapeutic nurse patient relationship. What are the components? The main component, first one is nothing but first component, very important, that is called as trust. What is meant by trust? Trust is nothing but for the patient to feel safe and confident with the nurse. So this is collectively called as trust. Next one is nothing but empathy. Empathy is also called as if policy. It is also called as if policy. It is a process of feeling the pain of the patient as our own. So that is called as empathy. There are lots of difference between empathy and sympathy. Empathy is nothing but following as if policies, understanding the patient pain and feelings as our own. So that is called as empathy. The next one is respect. Respect is also called as self-esteem. So along with that, while giving a care, while giving a promotion of care, we need to maintain the respect of the patient while protecting their comforts and rights. The next one is professional boundaries. So while giving care, while communicating, while building interpersonal relationship, we should not go out of professional boundary. What are the professional boundary? We have to maintain the professionalism while giving care to the mentally ill patient. Next one is confidentiality. Confidentiality means some of the patient, they may have lots of contagious disease, communicable disease, that should be maintained confidential. We should not spread to others. This and all comes under patient rights, protecting the patient information, the baseline data, surgical data, medical data, all the data should be keep secret. That is called as maintain confidentiality. The last one is called as effective communication. If we are not maintaining the effective communication, that will lead to crisis, that will lead to the abnormality in the care. So if we are not maintaining the proper communication, the care is not maintained. The care is not maintained. Then discharge will be delayed. Discharge will be delayed. So this and all the main components. What are the main components? First one is trust. Next one is empathy. Next one is respect. Next one is professionalism and confidentiality. The last one is called as effective communication. Last one is called as effective communication. Then next move on to the next question is the phases. The phases are also called as stages. The phases of therapeutic nurse-patient relationship. What are the phases? First phase is called as pre-interaction phase. Second one is called as orientation phase. Third one is called as working phase. Fourth one is called as termination phase. Then what is meant by pre-interaction phase? Pre-interaction phase is nothing but it is a process of preparing the patient. It is a process of preparing the patient. Along with that, we are going to preparing ourselves to meet the patient. That is called as pre-interaction phase. Then second one is orientation phase. Orientation is nothing but we are going to introducing about ourselves, who we are, why we come to your ward, what is the purpose of our visit, that we are going to introducing. Orientation phase is also called as introduction phase, and establishing a trust and goal settings. Third one is working phase. Working phase is nothing but here we are going to solving the actual problem. What is the chief complaints of the patient? Based on the chief complaint, we are administrating the medicine. So that is collectively called as problem solving and administration of therapy. We have the varieties of therapy. That therapy we are going to giving to the patient. Along with that, we are monitor the behavior of the patient. The last phase is called as termination phase, or also called as evaluation phase. It is also called as evaluation phase. What is mean by evaluation? Evaluation is nothing but it is an assessment of our goals, our planning is met or not met. If it is not met, again we need to start from the pre-interaction phase. So this is a cyclic. So this procedure and these phases are cyclic in nature. So this is a systematic. So it is according to step by step. What is the first one? Pre-interaction. Second one is orientation. Third one is working phase. Last one is termination phase. It is a very important question. Definitely they will ask for the next examination. Then the another question is define psychiatric emergency. Define psychiatric emergency. Emergencies are also called as crisis. It is also called as crisis, or also called as danger. It is also called as danger. Then what are the psychiatric emergencies? What is nothing but psychiatric emergency? Psychiatric emergencies are acute disturbance. It is an acute disturbance in behavior, mood, or thought that pose an immediate risk. It is immediate risk to the patient or other and require urgent medical and nursing intervention. So this is called as emergency. And emergencies are nothing but these are the disease condition. It may affect our behavior, it may affect the mood. So it need emergency treatment, it need urgent intervention. What may be the intervention? It may be medical intervention, it may be not surgical. The nursing intervention can be given to mentally ill person. Then what are the best examples for psychiatric emergency? It may be eating disorder, it may be anxiety, it may be a sexual disorder that will leads to death. It may be depression. Very important is called as depression. If the depression is untreated, then that will leads to suicidal thoughts. So that will leads to self-harm. That will leads to death of a patient. So that is the reason we need immediate and urgent care. We need immediate and urgent intervention. It may be medical, it may be nursing, or application of psychotherapy, group therapy can be administered to the person who is suffering from mentally ill disease. This is all about psychiatric emergency. While writing the psychiatric emergency, you should write regarding definition, then what are the types, then what are the signs and symptoms. The last one is called as what is a nursing interventions or a medical intervention. That should be written in the paper. The next question is the role of nurse in the prevention of suicide. Here you need to write regarding the roles and responsibilities of nurse. Then the first point is identifying the warning signs such as hopelessness and withdrawal. The second one is assessing the suicidal thoughts, plans and the means. The third one is providing emotional support and active listening. Fourth one is ensuring a safe environment by removing harmful objects. Next one is maintaining close observation of high-risk patient. Next point is encouraging family support and counseling. The last one is referring the patient for psychiatric treatment and follow-up. Here, what are the main the responsibilities of nurse? We need to assess, we need to plan, we need to find a diagnosis. Along with that, we need to take a proper intervention. Last thing is evaluation. Along with that, we need to triage the patient to which department the patient is to be go. So this is nothing but we have to send the patient for psychiatric treatment and follow-up. Regular follow-up also should be need. This and all the roles and responsibilities of nurse regarding prevention of suicide. The next question is state whether the following statement are true or false. The first one is the organizing principle of personality is called as identity. Yes, it is true. Why? Because this is a statement which is given by Erikson, in a psychosocial theory. The second one is Asperger disorder is categorized as an autism spectrum disorder. Yes, of course, it is a true statement. Then we need to write true. Then the third true and false. loss of memory is called as amnesia. Amnesia is nothing but it is a disease condition which is characterized by the partial or permanent or complete loss of memory. So this is also true statement. The next one is series of words. Series of words that seems totally unrelated is called as salad. Salad is nothing but it is a mix. It is a mix of everything. So that is called as salad. Yes, of course, this statement is also a true. Then the next question is nothing but writing short notes. What is the first question? Adolescent crisis. Adolescent crisis is nothing but crisis is also called as danger. The crisis is also called as danger. Then what is a short note about the adolescent crisis? The first one is an adolescent crisis refers to emotional and psychological stress occurring during the adolescence. So the main definition of adolescence crisis is nothing but emotional or psychological stress during the adolescence is called as adolescent crisis. Second one is common causes includes identity confusion, peer pressure, academic stress, and family conflict and hormone related changes. The third one is manifestation includes mood swings, rapid changes in the moods, anxiety and rebellion, withdrawal and risk-taking behavior. Withdrawal is nothing but socially withdrawal or familial withdrawal. The fourth one is early identification and counseling, family support and guidance should be given. For this kind of crisis, what is the main management? Early diagnosis. Prevention and protection is better than repent and repair. So that is the reason we need to find the disease as much as early. That is called as early identification, counseling, face-to-face, direct counseling, then family support, encouragement and support from the family and acceptance from the family should be needed. The last one is the roles and responsibilities of the nurse. What is the roles and responsibilities? So it's about promotion of health education and emotional support should be given to the patient. The next question is acute psychosis. What is meant by psychosis? Psychosis is nothing but it is the loss. It is the loss of contact. It is a loss of contact with the reality of the world. So this is called as reality of the world. This is called as psychosis. This is called as psychosis. Then what is acute psychosis? Acute psychosis is a sudden onset mental disorder which loss of contact with the reality. This word should be written. So while writing the answer, you should be organize the answers. Organize the answers. Next one is feature includes delusion. Delusion is nothing but false belief. Hallucination is nothing but false hearings, wrong perceptions. Then disorganized speech and disturbed behavior. Behavior should be disturbed. So these are all the features are also called as signs and symptoms. Next one is what are the causes? Causes may be schizophrenia, it may be substance abuse, it may be infections, it may be severe stress. The last one is management includes antipsychotic medicine, hospitalization and supportive nursing care, and we have to educate the family, educate the patient regarding the disease condition. Along with that, ensuring the patient safety in pre-early. Pre-early is a first priority. What is the first priority? We have to maintain the patient safety from the self-harm because it is a severe kind of brain disorder. The next one is sexual disorder. What about the sexual disorder? Sexual disorder or condition involving disturbance in a sexual desire, arousal and performance. Then next one is types include sexual dysfunction, paraphilia. Paraphilia is nothing but it is an increased urge. It is an increased urge. Then the gender identity disorder. Third point is what are the causes of sexual disorder? The causes it may be psychological, it may be hormonal, it may be social and medical. The next one is management includes psychotherapy and counseling and medical treatment. Medical treatment by using a different type of antidepressants and antipsychotic drugs can be administered. The last point is roles and responsibilities of the nurse. What is the roles and responsibility? We can educate, we can promote, we can give assurance. So education, assurance and the confidentiality should be maintained. So this and all regarding sexual disorder. The next question regarding mental health assessment. Assessment means what? Assessment is nothing but it is the process of collecting a data or collection of information about the patient. This is all about mental health assessment. So mental health assessment is a systematic means step by step should be collected, systematic evaluation of the person's psychological status. So here we are gathering the data about a individual psychological status. So next one is it includes history taking and mental status examination and observation of the behavior of the patient, whether the behavior is cognitive, affective. To check the behavior of the patient, this assessment, this gathering the information is very most important. Third one is what are the areas are assessed. The areas are assessed such as appearance, mood, thought process, perception, cognition, and insight. Insight is nothing but whether the patient is aware about the disease condition. To check the insight also, we need to go for assessment. The next one is to help in the diagnosis, treatment, and planning and evaluation of the care. What is the roles and responsibilities of the nurse? Nurse plays a key role in data collection. While collecting a data should be from the primary source, data should be concrete, data should be correct, data should be current. So this and all the 3 C's we have to follow while collecting the data, and documentation should be done. So this and all regarding mental health assessment. It is a very important question. Definitely they will ask in the examination. Then what is the next question? Answer the following. Define schizophrenia. What is meant by schizophrenia? Schizophrenia is nothing but it is a chronic severe mental disorder which is characterized by disturbance in thought, perception, emotion, and behavior, leading to impaired function and loss of contact with the reality. So this is the definition of schizophrenia. While writing, you have to write and organize the answer in the form of introduction, definition, and the types and management. The next question, nursing management of the patient with the paranoid schizophrenia. Paranoid schizophrenia is a type of schizophrenia. What is the nursing management? Here, while writing the answer, you have to read the question clearly. They have given nursing management. Only you need to write regarding nursing management. Nursing management includes establishing the therapeutic nurse-patient relationship. Already we have discussed regarding therapeutic nurse-patient relationship by using a component such as trust, confidentiality, and communication should be maintained, and relationship also should be maintained. Second one is ensuring the safety of the patient and others. Third one is managing the delusion. Delusion is nothing but false belief and hallucination, wrong perception without arguing or reinforcing them. Next one is providing calm, clear, and simple communication to the patient and the patient family. Next one is administrating the antipsychotic medicines and observing for the side effects. We need to monitor the side effects and contraindication of the drugs also. Next, we have to encourage self-care about the physical hygiene, oral hygiene. Along with that, we have to educate the family regarding social interaction, and social and group therapy also we need to administer to the patient. Next one is educating the patient family about the illness and treatment. We have to educate the patient, along with that the family, regarding what treatment is going on, what is the effect of the treatment. As a family, how you need to give assurance. As a family, how you need to give support to the both doctor and the patient. That should be explained clearly and properly. While administrating the medicine also, you should take the consent should be taken. The last one is maintaining a structured and low stimulus environment. It means maintaining the therapeutic environment. According to milieu therapy, we need to maintain the environment which is favorable for the patient. In the same way, we need to maintain the structured environment. This is all about the nursing management of the patient with the paranoid schizophrenia. Here they have asked only regarding paranoid schizophrenia. Paranoid is nothing but delusion. Here only we need to write regarding paranoid schizophrenia. Then the next question is nothing but define psychiatric nursing. Define psychiatric nursing, are also called as mental health nursing. What is meant by mental health nursing? So psychiatric nursing is a specialized field. It is a specialized branch of nursing concerned with the promotion of health of the mentally ill person and prevention of mental illness and individual rehabilitation. Along with that, rehabilitation of the client. So that is collectively called as psychiatric nursing. Psychiatric nursing is a specialized field of nursing concerned with the promotion of mental health, prevention of mental illness, and care of individual with the mental disorder using therapeutic approaches. We have different type of therapeutic approach. It may be therapies, it may be drugs, it may be psychotherapy, it may be pharmacotherapy, it may be group therapy, it may be milieu therapy. All the type of therapy we can give, and we need to promote the health of the patient. That is collectively called as psychiatric nursing, are also called as mental health nursing. Then the next question, very important question. So that is called as principles of psychiatric nursing. What are the principles? While writing the principle, you need to write according to point. According to the point, you need to write. What is the first principle? Acceptance of the patient as they are. It means we have to accept the patient how they are, irrespective of caste, irrespective of creed, irrespective of gender, irrespective of color. We need to accept the patient instead of doing discrimination. The next one is individualization of the care according to the patient needs. Based on the patient, based on the family, based on the background and history of the patient, we need to give appropriate care. The third one is maintaining the therapeutic communication. Very important. Therapeutic communication between patient and nurse, or doctor and nurse, or family and nurse. See, here we need to maintain the therapeutic communication. The communication is only related to therapy. Next one is establishing the trust and rapport. Interpersonal relations should be maintained. Next one is maintaining the professional boundaries, ensuring the confidentiality, promoting the patient participation in the care, and using the holistic approach. So these are all the very important principles of psychiatric nursing. Then these are all the model questions. These are all the very important questions we are going to give. So you need to practice. See, what are the questions? Definitely, these are the very important questions. They repeatedly they will ask in the future examination. So give the meaning for 1 mark. First one is addiction, bulimia nervosa, insomnia, mania, compulsions, and hypomania, and rapid, neologism, insight, euphoria, personality, and bulimia. These are all the very important questions. Definitely they will ask in the examination. The next one is called as fill in the blanks. Fill in the blanks. A sudden onset of severe mental disturbance is called as dash. The therapeutic use of environment is called as dash therapy. Then repetition of words spoken by others is known as. Then persistent sadness and loss of interest is called. An excessive irrational fear of an object situation is called. Then sleep disorder characterized by repeated daytime sleep attack is called. The next one is elevated mood with the increased energy and activity is called. And a condition in which the patient talks continuously and rapidly is called as. Then the phase in which the nurse and patient work together to achieve the goals is called dash phase. Which phase? Then the sudden intense fear with the physical symptoms is called dash attack. So these are all the very important fill in the blanks. They are recurrently asked in the examination. Next fill in the blanks such as fear of height, false perception regarding increased sense of psychological well-being, anti-anxiety drug are also called as what? An eating disorder characterized by binge eating. So this is called as what? Then treatment using electric current, severe mental illness. So this is called as what? Next one is inability to recognize the familiar people or object is called as what? Next, the National Mental Health Program. Regarding it, definitely they will ask one question. The next one, care given to mentally ill patient in community is called. So which psychiatry? That should be written. Then other model questions state whether the following statement are true or false. Forgetfulness is predominant symptoms in dementia. Whether it is true or false, that should be find the answer and write it. Alcohol is a CNS stimulant. Next one is IQ is the ratio between mental age and chronological age. Catatonia is a type of schizophrenia. The next, schizophrenia is a neurotic disorder. Echolalia is a repetition of action. Then a false unshakable belief is called as illusion. The next one is antipsychotic drugs are also called as major tranquilizer. Is it correct? Is it true or false? That should be find the answer. The organizing principle of the personality is called as identity. Next, Asperger disorder is characterized as an autism spectrum disorder. These are all the best example. These are the model questions for true and false. The next questions such as answer the following principles of mental health nursing. Very important. See, psychosomatic disorder. Types of crisis. Next one, role of nurse in a psychosocial therapy. Next one is the types of admission according to Mental Health Act of 1987. So Mental Health Act, Indian Lunatic Act, everything is same. Next one is define schizophrenia. Then what are the signs and symptoms of schizophrenia? Then discuss the nursing management of patient with the paranoid schizophrenia. Next, illusion and hallucination. What is illusion? What is hallucination? So you need to write in brief. Next one is obsession and compulsion. So regarding OCD also you need to write the pressure of speech and poverty of the speech. Regarding that also you need to write the answer. Very important question. Last one is anorexia nervosa and bulimia nervosa. These are the classification of eating disorder. It is a classification of eating disorder. The next model questions are define therapeutic nurse patient relationship. Next one, discuss the phases of therapeutic nurse patient relationship. Write the classification and identification of antidepressant drugs. Next, legal responsibilities of psychiatric nurse, rights of mentally ill patient, disorders of thoughts, define psychopharmacology, explain the role of nurse in the care of the patient receiving antipsychotic drugs, define organic mental disorder, list down the types of organic mental disorder, explain the nursing management of the patient and dementia, principles of mental health nursing. Repeatedly asked questions, so it is a very important. Psychoosmotic disorder. Last one is types of crisis. What are the different type of crisis we have? These are all the very important question. The next one is other model questions. So these are all the very important questions that you need to write down and try to find the answers and make a note on it. So these are all the questions recurrently and repeatedly they will ask. I hope you all understand. Thank you, and be careful about your examination. All the best for your exam and try to find all the answers. Stay tuned with Ezinurse.